If you ended up getting a relief system, from a conference, maybe they sent you one, this is how you set it up. So what a relief is it's a suction that attaches to your high volume suction so you can manage the water a little bit better, but it's a hands-free device. So a couple things about it. It comes in multiple parts. So we have this tubing first. This tubing, then you have this section that comes in the tube, and then you have the leaf. So everything that's white and gray can be autoclaved. The green leaves, which actually you can get them in different colors now too, these ones are disposable. So you throw this away after your patient. These ones you can get autoclaved. So you're gonna start with a longer tube. It has this little end, and then they come with these little U shapes now, which I really, really like because it holds your tube when you're not using it. So this part connects to your high volume. And then you're left with this little connector. This connector is going to connect with this second part. And this part you're gonna want to autoclave between every patient. This one you can use all day and then run your suction lines through and autoclave at the end of the day. But this one you'll want to replace out. And then at the steel U shape, you're gonna attach your leaf, and it just snug right in here. So you'll notice with these leaves, they have like a little two parts to them. It's gonna be stuck together. And then you're going to put it on your patient's cheek. Okay, now we have the relief set up. It's ready to go. I'm gonna use it on my patient's cheek. And you can place it wherever their head's turning. So if they're turning to the left, I put it on the left so the water is like flowing to that area. Same thing over here. So you just kind of cup it. It's gonna sit like on the buccal mucosa, just kind of sit in the cheek like that, at the teeth. And then you just turn it on. And then they're gone. And then again, you can do it on the other side. So now they do actually have the actual reliefs in different sizes. They have like a smaller size, a larger size, and they're different colors, which is kind of nice to make it easy. So you can custom fit it with your patient, depending on what population you see or your patient's mouth size. But it's a handy little hands-free device to help keep the water in control. I find that when I use it too, patients don't feel like they have to close, which we don't love, but don't have to close as much because we're managing the water, and which is nice. I also find that I don't get as much water on their face when I use it. In the anterior, you're always getting some in the face, I feel like, but it can help kind of manage that spray a little bit, get some of those aerosols, and then manage the water that's sitting in the mouth as well. So if you have one and you haven't tried it yet, now is the time to pull it out. Give yourself a little bit of grace with that learning curve, but I think once you use it, you're really gonna love it.